Influenza, commonly known as the flu, is a contagious respiratory illness caused by influenza viruses. It affects the nose, throat, and sometimes the lungs, leading to mild to severe illness. Every year, millions of people around the world catch the flu, and while most recover in a few days, some can develop serious complications. Understanding what influenza is helps us recognize its impact on public health and the importance of prevention. In this video, we'll explore everything you need to know about influenza, from its symptoms to how it spreads and how you can protect yourself and your loved ones. There are several types of influenza viruses, but the most common ones that infect humans are influenza A and B influenza. Viruses are known for causing pandemics and can infect both humans and animals, while influenza B viruses typically only affect humans and tend to cause seasonal outbreaks. Understanding the differences between these types helps scientists develop effective vaccines and treatment. Influenza C causes milder respiratory symptoms and is less common, while influenza D primarily affects cattle. Knowing these distinctions is key to understanding how the flu virus evolves and spreads. Influenza spreads mainly through droplets when an infected person coughs, sneezes, or talks. These droplets can land in the mouths or noses of people nearby or be inhaled into the lungs. The virus can also survive on surfaces for a short period, so touching a contaminated object and then touching your face can lead to infection. Crowded places and close contact increase the risk of transmission. That's why flu outbreaks often happen in schools, offices, and public transportation. Understanding how the virus spreads is crucial for taking steps to prevent infection. Symptoms of influenza usually appear suddenly and can include fever, chills, cough, sore throat, runny or stuffy nose, muscle or body aches, headaches, and fatigue. Some people may also experience vomiting and diarrhea, though this is more common in children than adults. The severity of symptoms can vary from person to person, but most people recover within a week or two. Recognizing these symptoms early can help you seek appropriate care and avoid spreading the virus to others. While anyone can get the flu, certain groups are at higher risk of developing serious complications. These include young children, elderly adults, pregnant women, and people with chronic health conditions like asthma, diabetes, or heart disease. For these individuals, the flu can lead to pneumonia, hospitalization, or even death. That's why it's especially important for high-risk groups to take preventive measures, such as getting vaccinated and practicing good hygiene. Most people, influenza is a self-limited illness, but it can sometimes lead to complications. These include pneumonia, bronchitis, sinus infections, and worsening of chronic medical conditions. In severe cases, complications can be life-threatening, especially for vulnerable populations. Recognizing the signs of complications such as difficulty breathing, chest pain, or persistent high fever is important for seeking timely medical attention. Early intervention can make a significant difference in outcomes. Diagnosing influenza is usually based on symptoms and clinical examination, but sometimes doctors use laboratory tests to confirm the infection. Rapid influenza diagnostic tests can provide results within minutes, helping guide treatment decisions. However, these tests are not always 100% accurate, so doctors may rely on their judgment, especially during flu season. Accurate diagnosis is important for distinguishing influenza from other respiratory illnesses and ensuring appropriate care. Most cases of influenza can be managed at home with rest, fluids, and over-the-counter medications to relieve symptoms. Antiviral drugs may be prescribed for people at higher risk of complications or those with severe symptoms. These medications work best when started early, ideally within 48 hours of symptom onset. It's important to avoid unnecessary antibiotics as they do not work against viruses. Always consult a healthcare provider for guidance on the best treatment options. Prevention is key when it comes to influenza. The most effective way to prevent the flu is by getting vaccinated every year. Good hygiene practices such as frequent hand washing, covering your mouth and nose when coughing or sneezing, and avoiding close contact with sick individuals also help reduce the risk of infection. Staying home when you're sick and disinfecting commonly touched surfaces can further limit the spread of the virus. Flu vaccine is updated each year to match the most common circulating strains of the virus. It's recommended for everyone over 6 months of age, especially those at higher risk of complications. The vaccine doesn't guarantee complete protection, but it significantly reduces the risk of severe illness, hospitalization, and death. Getting vaccinated also helps protect vulnerable members of the community by reducing the spread of the virus. Flu vaccine works by stimulating your immune system to produce antibodies against the influenza virus. These antibodies help your body recognize and fight the virus if you're exposed. It takes about 2 weeks after vaccination for protection to develop, so it's best to get vaccinated before flu season starts. While the vaccine isn't 100% effective, it remains the best defense against serious flu-related complications. Most people experience only mild side effects from the flu vaccine, such as soreness at the injection site, low-grade fever, or muscle aches. Serious allergic reactions are extremely rare. The benefits of vaccination far outweigh the risks, especially for those at higher risk of complications. If you have concerns about the vaccine, talk to your healthcare provider for personalized advice. It's easy to confuse the flu with the common cold, but there are important differences. The flu tends to cause more severe symptoms, such as high fever, body aches, and extreme fatigue, while colds usually result in milder symptoms like a runny nose and sore throat. The flu can also lead to serious complications, especially in vulnerable populations. Knowing the difference helps you take the right steps for treatment and prevention. Most people with the flu recover at home, but certain warning signs mean you should seek medical attention. These include difficulty breathing, chest pain, persistent high fever, confusion, or severe weakness. Children, elderly adults, and those with chronic health conditions should be especially vigilant. Early treatment can prevent complications and improve outcomes. If you're caring for someone with the flu, it's important to provide comfort, ensure they stay hydrated, and monitor for signs of complications. Encourage rest, offer fluids and light meals, and keep their environment clean. Practice good hygiene to avoid catching the virus yourself and seek medical advice if symptoms worsen or new concerns arise. Children are particularly susceptible to influenza and can experience more severe symptoms than adults. They may also be more likely to develop complications like ear infections or pneumonia. Vaccination is especially important for children, and parents should watch for warning signs such as difficulty breathing, high fever, or persistent vomiting. Prompt medical attention can help prevent serious outcomes. Older adults are at greater risk for severe influenza and its complications. Age-related changes in the immune system make it harder to fight off infections, and chronic health conditions can worsen during a bout of flu. Annual vaccination and prompt treatment are especially important for this group. Family members and caregivers should also be vigilant for signs of complications. Pregnant women are more likely to experience severe illness from influenza due to changes in the immune system, heart, and lungs. The flu can also pose risks to the developing baby. Vaccination during pregnancy is safe and provides protection for both mother and baby. Pregnant women should seek medical care promptly if they develop flu symptoms. People with chronic health conditions such as asthma, diabetes, or heart disease are more vulnerable to severe influenza and complications. Managing underlying conditions and getting vaccinated each year are crucial steps for protection. If you have a chronic illness, talk to your doctor about the best ways to stay healthy during flu season. Flu season typically occurs during the colder months from fall to early spring. The virus spreads more easily in cool, dry air, and people tend to spend more time indoors, increasing close contact. Public health officials monitor flu activity and recommend vaccination before the season peaks. Understanding flu season helps you prepare and take preventive steps at the right time. Influenza is a global health concern, causing millions of cases and hundreds of thousands of deaths each year. The virus can spread rapidly across countries and continents, leading to seasonal epidemics and occasional pandemics. International cooperation and surveillance are essential for tracking new strains and coordinating responses. The global impact of influenza highlights the need for ongoing research and public health efforts. Seasonal flu occurs every year and is caused by influenza viruses that are already circulating among people. Pandemics, on the other hand, happen when a new influenza virus emerges and spreads globally, often causing more severe illness. The most famous example is the 1918 Spanish flu pandemic. Understanding the difference helps public health officials prepare for and respond to future threats. Throughout history, influenza pandemics have had a major impact on societies. The 1918 Spanish flu caused millions of deaths worldwide, while later pandemics in 1957, 1968, and 2009 also led to widespread illness and disruption. Studying past pandemics helps scientists and public health officials learn how to better prepare for and respond to future outbreaks. Influenza viruses are constantly changing through a process called antigenic drift and shift. Small changes or drifts happen frequently and can lead to new strains each year. Occasionally, a major change or shift creates a completely new virus that can cause a pandemic. This constant evolution is why the flu vaccine needs to be updated annually and why ongoing surveillance is so important. Influenza viruses can infect not only humans but also animals like birds and pigs. These animal reservoirs play a key role in the emergence of new flu strains. Sometimes, viruses from animals can mix with human viruses, creating new combinations that can spread to people. Monitoring animal populations is an important part of preventing future pandemics. Public health agencies around the world monitor influenza activity through surveillance systems. These systems track the spread of the virus, identify new strains, and provide data for vaccine development. Surveillance helps detect outbreaks early and guides public health responses. International collaboration is essential for effective surveillance and control. Antiviral medications can help reduce the severity and duration of influenza if taken early. These drugs are especially important for people at high risk of complications. They work by inhibiting the virus's ability to replicate in the body. However, not all flu strains respond equally to antivirals, and resistance can develop, so they are used selectively. Hygiene practices are essential for preventing the spread of influenza. Washing your hands frequently, using hand sanitizer, and avoiding touching your face can all help reduce your risk. Covering your mouth and nose when coughing or sneezing and regularly cleaning surfaces are also important steps. These simple habits can make a big difference during flu season. Wearing masks can help reduce the spread of influenza, especially in crowded or high-risk settings. Masks block respiratory droplets that carry the virus, protecting both the wearer and those around them. During outbreaks or flu season, masks are a simple and effective tool for reducing transmission, particularly in healthcare settings or public transportation. Schools and workplaces are common sites for flu outbreaks due to close contact and shared spaces. Encouraging vaccination, promoting good hygiene, and staying home when sick are key strategies for reducing the spread. Employers and schools can also support prevention by providing hand sanitizer and flexible sick leave policies. Travel, especially by air, can increase your risk of catching or spreading influenza. Airports and airplanes bring people from different regions together, making it easier for the virus to spread. If you're traveling during flu season, get vaccinated ahead of time, practice good hygiene, and consider wearing a mask in crowded places. There are many myths about influenza, such as the belief that the flu vaccine can give you the flu or that healthy people don't need vaccination. In reality, the vaccine contains inactivated virus and cannot cause illness. Even healthy people can get the flu and spread it to others. Understanding the facts helps you make informed decisions about prevention and care. Influenza and COVID-19 are both contagious respiratory illnesses, but they are caused by different viruses. Some symptoms overlap, making it hard to tell them apart without testing. Both can lead to serious complications, especially in vulnerable groups. Vaccination, good hygiene, and staying home when sick are important for preventing both illnesses. Because influenza and COVID-19 share many symptoms, testing is often needed to distinguish between them. Rapid tests are available for both viruses, and your healthcare provider can help determine which tests are appropriate. Accurate diagnosis ensures you get the right treatment and helps prevent the spread of illness to others. Public health agencies play a vital role in controlling influenza. They monitor outbreaks, develop vaccination campaigns, and provide guidance to healthcare providers and the public. Their efforts help reduce the impact of flu season and protect vulnerable populations. Staying informed about public health recommendations is an important part of staying healthy. Antibiotics do not work against influenza because it is caused by a virus, not bacteria. Overuse of antibiotics can lead to resistance, making bacterial infections harder to treat. It's important to use antibiotics only when prescribed for bacterial complications, not for the flu itself. Responsible use helps protect everyone's health. While there's no cure for influenza, home remedies can help relieve symptoms and speed recovery. Rest, hydration, and over-the-counter medications for fever and aches are helpful. Warm fluids like soup or tea can soothe a sore throat. Always consult your doctor if symptoms worsen or you have underlying health conditions. Nutrition supports your immune system and helps you recover from influenza. Eating a balanced diet with plenty of fruits, vegetables, and fluids can make a difference. Avoid alcohol and caffeine, which can dehydrate you. If you're unable to eat due to nausea or vomiting, try small, frequent meals and focus on staying hydrated. While regular exercise is important for overall health, it's best to rest when you have the flu. Exercising while sick can put extra strain on your body and slow recovery. Once you're feeling better, gradually return to your normal activity level. Listen to your body and don't rush the process. Being sick with the flu can take a toll on your mental health, leading to feelings of frustration, isolation, or anxiety. It's important to take care of your emotional well-being as you recover. Stay connected with loved ones, practice relaxation techniques, and seek support if you're feeling overwhelmed. Mental health is just as important as physical health during illness. After recovering from the flu, it's important to wait until you're fever-free for at least 24 hours before returning to work, school, or other activities. This helps prevent spreading the virus to others. Ease back into your routine and continue practicing good hygiene to protect yourself and those around you. Most people recover fully from influenza, but some may experience lingering fatigue or cough for weeks. Rarely, complications can cause long-term health problems, especially in those with pre-existing conditions. If you're not feeling better after several weeks, consult your healthcare provider for further evaluation and support. Protecting yourself from influenza also helps protect your community, especially those who are most vulnerable. Getting vaccinated, practicing good hygiene, and staying home when sick all contribute to community health. By working together, we can reduce the impact of flu season and keep everyone safer. Researchers are constantly working to improve influenza prevention, from developing better vaccines to finding new treatments. Advances in technology and global cooperation are helping us stay ahead of the virus. Staying informed and following public health recommendations will continue to be important as we face new challenges in the future. Influenza is a serious but preventable illness that affects millions each year. Understanding how it spreads, recognizing symptoms, and taking preventive steps like vaccination and good hygiene can make a big difference. By staying informed and working together, we can protect ourselves and our communities from the impact of the flu. Remember, prevention is always better than cure, and your actions matter in the fight against influenza.